This is a talk on BiPAP, which stands for Bilevel Positive Airway Pressure. It's very similar to CPAP, but the bilevel part means the pressure is set at two levels, one for inspiration, one for expiration. During inspiration, the positive pressure is generally higher than CPAP. The positive pressure reduces during exhalation, but as it's there, this stops the patient reaching closing volume, preventing collapse. Both inspiration and expiration are passive. Unlike CPAP, this passive expiration enables the patient to blow off any retained CO2. Low oxygen and high CO2 is a good indication for BiPAP. This is type 2 respiratory failure. You are likely to see type 2 respiratory failure in other cases, such as COPD, chest wall deformity, neuromuscular disorder, severe atelectasis, labor collapse causing CO2 retention, and consolidation. Contraindications for BiPAP include facial trauma and burns, recent facial upper airway or upper gastrointestinal surgery, life-threatening hypoxemia, impaired consciousness, vomiting, nausea and secretions like CPAP, which obviously you can't take the mask off to remove anything, and undrained pneumothorax. This video is for BiPAP. The mode is set to ST, this stands for spontaneous timed. If the patient doesn't breathe, the device will deliver the breath for them. This bit is IPAP, which is the inspiratory positive airway pressure, starting at what is set to 12 but can go up to 15 centimetres of water. The EPAP, which is the expiratory positive airway pressure, is set at 5 but can go up to about 7 centimetres of water. So you can see that they're set at different pressures, showing that it's BiPAP. The rise time, this is how quickly the machine goes from expiratory pressure to inspiratory pressure. In the acute setting, you want it to be set as low as possible, so this is 1, sort of 1 and 2, as they'll need the breath quickly. This is the backup rest rate. For example, if the respiratory rate drops to 8 breaths per minute, it will kick in to ensure the patient receives, in this case, 10 breaths per minute. The I time set at 1.2 seconds is the time that the inspiratory breath is given to the patient. The ramp time, like in CPAP, we said, is not used in acute settings, so it'll be discussed further in a teaching session. So the patient data is the same in the CPAP video. I want to draw your attention to this trigger bit, which lets you know if the breath is spontaneous or if it's been triggered by the machine. So you can see that's from the patient. If the patient isn't taking a breath, it will come up with timed, and that's when the machine's kicking in for them. This bit, as in CPAP, it's set at 5 and stays at 5. For BiPAP, it's fluctuating between 5 and 12 centimetres of water, which is what it's set to.